Today, let's talk about ticagrelor for patients undergoing coronary artery bypass grafting, a meta-analysis of randomized controlled trials. Ticagrelor may be an alternative to aspirin as it provides robust and consistent platelet inhibition. However, the effect of ticagrelor treatment in patients undergoing coronary artery bypass grafting has not been well confirmed. We conducted a meta-analysis to appraise whether ticagrelor therapy affects outcomes in coronary artery bypass grafting patients. The methods were searched from PubMed, Embase, EBSCO, and Cochrane databases from its inception up to 4 December 2020 for randomized controlled trials that assessed ticagrelor versus non-ticagrelor in patients undergoing CABG, that is, coronary artery bypass grafting. The primary outcome was the incidence of saphenous vein graft occlusion at 1 year after CABG. Secondary outcomes were SVG occlusion at 7 days, major adverse cardiovascular events, and bleeding requiring reoperation. Coming to the results, 7 trials including 4,305 patients were included. 130 of 1,140 patients randomized to the ticagrelor group versus 175 of 1,220 patients randomized to the non-ticagrelor group experienced SVG occlusion at 1 year after CABG. Compared with the control group, ticagrelor therapy yielded a significantly lower risk of SVG occlusion. In the subgroup analysis, ticagrelor plus aspirin compared with aspirin alone did not decrease the risk of SVG occlusion after 1 year. There was no difference in the incidence of SVG occlusion at 7 days, MACE up to 1 year, or bleeding requiring reoperation. To conclude, compared with non-ticagrelor therapy, ticagrelor decreased the risk of saphenous vein graft occlusion after 1 year in patients undergoing elective coronary artery bypass grafting with saphenous vein grafting.